Ruth, can you? Thank you. So thank you, Bob, and I want to thank all of you for joining us. I see a lot of new faces, some friend that we have known for many years, and some new ones. So I want to welcome all of you to our monthly meeting. Our local chapter of Amnesty International. We meet on the first Monday of the month. From the meeting actually is from 6:30 to 7:30 p.m., but we have 30 minutes of social time from 6 to 6:30. So if you save your spot on your calendar, you will get one or two emails a month to remind you of who the speakers are and the recording for the previous month's meeting. So today's meeting, it's an outstanding speaker and a close friend of Ruth and I for many years, Munira Bangee. She is the current Vice President of Center for Sustainable Healthcare Quality and Equity for National Minority Equality Forum. She is a strategic public health leader with over 15 years of experience across government, nonprofit, and corporate sectors. As the VP, she oversees a portfolio of 16 plus active grants focused on chronic disease prevention, clinical trial diversity, cancer screening, and community health education in underserved communities. Before she took this position, in her former position, she was the Chief of Staff for City Council at Large position for Council Office, Letitia Plummer's office, where she led cross-departmental initiatives, including the council members' COVID-19 vaccine drive-through clinic operations. Her community-facing work includes developing a grassroots canvassing and enrollment strategy for the Fifth Ward Early Cancer Detective Study in Houston. Munira brings a strong belief that quality healthcare is not a privilege but a right, and that closing equity gaps requires both community trust and systems level accountability. So please join me in welcoming Munira to our monthly program. The title of her presentation is Healthcare is a Human Right. Go ahead, Munira. Thank you.
Okay, I'm gonna go ahead and share my screen. It sent you a request, I think.
Yeah, Ruth, can you please? Ruth is our Zoom master.
Okay.
I gave you permission.
All right. Can you see my screen?
Yeah, I
Okay.
can see it.
So good evening, everyone. It's so great to see such a great and engaged crowd of people on this call. So as Mohammed Nasrullah mentioned, my name is Munira Bangee, and I'll tell you a little bit more about myself in a moment. But today's topic is healthcare is a human right. And whether that's a statement or a question, we're going to discuss further. But this is a topic that's very close to my heart. I work in public health and advancing equity. So this is something that I'm very passionate about. So just some background about who I am. I'm the vice president and I work for the National Minority Equality Forum. Our organization is absolutely amazing. Some of you may be familiar. I think Leticia knows our organization well. We're all about making sure that people become better advocates when it comes to their healthcare. We're about changing policy. We're about using data-driven insights to make health equity a possibility. And so where you live, how much you make, should never, ever decide whether you get to see a doctor. So at the NMQF, we are an organization that looks at what are the barriers to basic healthcare, getting access to healthcare. We look at structural racism in policy. We're looking at gaps. We're identifying gaps. We're somebody that really believes in making sure that equitable healthcare is the norm in any community. We're looking at insurance gaps. We're looking at inequity in maternal mortality. So all the topics that we're kind of covering are things that my organization does really, really well. And then in this presentation, one of the things that we'll cover is how do you take action? And I think some of you before this call began already asked those questions about what can I do to petition my government, talk to my representatives, and even in my community, what can I do to make things better? So the National Minority Policy Forum, we're a non-profit organization, we're a national non-profit, and we work on eliminating health disparities through research, data, education, policy. We build coalitions because it will take a coalition, like it takes a village to raise somebody, it takes a coalition to make change. And so there are 6 centers plus the Office of the President. So in our 6 centers, my center, the one that I lead, is the Center for Sustainable Healthcare, where we educate clinicians, community leaders, we have health champions, and we work with faith-based organizations. We also have a center that works on clinical research and social research in underserved populations. We've done a lot of work around COVID-19. We did a 5-year project with the CDC, which unfortunately under this government came to an end. And we look at clinical trial diversities as well. So CSSR looks at clinical trial diversities. Unfortunately, underserved communities do not participate in clinical trials, and there's good reason for it. We have a history with Tuskegee, and so people don't trust them. And that's why a lot of the medication that's on the market right now isn't it doesn't work for minority communities because they're made for a different demographic. So we work on that too. Our Center for Health Information and Strategy we have over 5 billion patient records that really drive the work that we do, especially the policy work that we do. We have a center that works on communications and public affairs. So we have our own media outlet called For Your Health News, and that covers all the changes that the government is making when it comes to healthcare. I'll give you a link at the end and definitely look that up, but it'll keep you up to date on what's happening nationally and also in your area. One of our centers works on public policy. So we're very, very well connected to Washington, DC. In fact, our headquarters, it's in Washington, D.C., right on Capitol Hill. So we have our Center for Public Policy works with our senators, our representatives to push policy. We've worked with them on many, many bills. And there are certain things right now that are very, very concerning. One of the things, I don't know if you're aware, but CMS is making changes to 340B. And 340B is how safety net providers, that would be something like Harris Health, how they get medication. Up until now, and at this current moment, the way it worked was they got medication at an extremely, extremely discounted rate, making it affordable for the people who came to their clinics. Well, they're making a change to that. They want them to pay the same rates as other providers, which would mean that systems like Harris Health will suffer. And in turn, the population, the 1 in 4 uninsured and underinsured population, will not be able to get the health care that they deserve. So if you're going to focus on a policy issue, and if you're going to write to your senators and your representatives, please talk about 340B. So that's our policy center. Then we have a center that works with professional organizations and it connects professional organizations, oncologists, clinical trial learning community, early detection doctors and professions, and then we also cardiologists. So we work with all these organizations, again, working both sides of policy and community. So we work at the intersection of that. I'm going to talk about my center before we, move on to the topic itself, so that you understand some of the things that if there's a gap in your community, how can you fill that gap? So we work on quality improvement projects, and that can be flu, vaccinations, early detection, colorectal cancer. But we work with the health system to improve the outcome in any one community. We work with community pharmacist ambassadors. Somebody mentioned earlier that some communities don't even have doctors. They might just have a pharmacy, or some communities may not even have a pharmacy. But there are many communities across rural Texas where there aren't clinics, there aren't doctors, but there might be a community pharmacist. And so we work with those pharmacists to educate them on key disease areas so that they can be that person who helps somebody who might be showing symptoms of a particular disease. We create health champions. That means we create health advocates. We work with people in the community. We train them on disease areas, and we get them to go into their communities to inform other people of everyday diseases and rare diseases and things like cancer. We work with, interestingly, organization works very well with barbershops and nail salons, because those people have huge audiences. When people come to get their nails done, they learn about their health, or they're getting their hair done. We've extended that to small businesses as well. So if you're a small business owner, there's an opportunity that you could work with us. This is all funded, so we don't expect anyone to work for free, but we do, give them a small stipend to work with us to get information out into the community. Some of the disease areas my center is currently working on: cancer early detection. What is cancer early detection? Cancer can be detected in your body 5 years before you develop symptoms. So it's a simple blood test costing about $1,000 to $3,000 if you go through your insurance or go through your doctor, but we bring it free to the communities. Again, we work with churches, we work with houses of worship. Another area we work on is ATTRCM, COPD, lupus, vaccinations, COVID preventions, Alzheimer's. These are some of my current projects. So that brings us to our topic for today, which is healthcare as a human right. And so Article 25 of the Universal Declaration of Human Rights, which was signed in 1948 by the United States, says everyone has a right to a standard of living adequate for health and well-being, including access to medical care, along with food, clothing, and housing. Now, whether that was done symbolically in 1948 or whether there was a plan to implement it is still something that we debate today. How much of that has become a reality? So what does that statement actually mean? It means that healthcare is a right owed to every person, regardless of what zip code they live in, what race they are, what background they come from, who should have access to healthcare. Healthcare should not be a commodity. Right now, people who are employed or who have a substantial income have access to the best healthcare. Sometimes they have access to just healthcare, but often to the best healthcare. This is supposed to be a measure of a society. This statement is supposed to measure society on how well they're keeping their human right commitments. And so this is what we're going to look at, especially when it concerns nationally what we see and what we see locally. So somebody like me who works on advancing equity, and if we think about the statement we just saw, there are people around the United States who are trying to make that a reality. But how do you make something like that a reality? Before you get to the point where every person has access to healthcare, they have access to clothing and food, there are certain things that we need to break down. And that is looking at what are the barriers, what are the obstacles to them having access to healthcare. And so in the communities that many of you have mentioned previously, but around the United States, we have many areas that are coverage deserts. There are no hospitals close by. Somebody mentioned that it takes them 45 minutes to get to a hospital. I was in East Harris County talking to a community member who told me that somebody in their family had a heart attack and it took them an hour to get to the hospital and they passed away by that time. And this is the United States of America, the superpower of the world. How is it that somebody doesn't have access to a hospital in a life-threatening situation. We also are, Texas is one of the 10 states that didn't expand Medicaid. And so what you have are people who are in this weird gap. They're too rich for Medicaid, but too poor for the to afford the subsidies for the Affordable Care Act. So these people don't have access to healthcare because they're stuck in the middle, and people are telling them they're either too rich or too poor. So then it takes us to another barrier. We have a shortage of providers, whether it's clinics, specialists, OB/GYNs, as people mentioned. We don't have enough gynecologists, especially in Black and rural minority communities in Texas. This is a huge issue. In fact, to the point where Harris County is a very dangerous place if you're a Black woman and you want to have a child. This is a very, very dangerous place because we do not have the specialists or the OB/GYNs that can serve the community. And again, that's one of the reasons we need to, as a community, as people in the greater Houston area, we need to advocate for people in the Black community, right? Because what affects them also affects us. The other thing is cost of care. It's not always that there's a coverage desert or there's provider shortage. And I'm going to give you the example of Fifth Ward in Houston. Fifth Ward is right next to the medical center. Houston's medical center is world renowned. We have people from international countries coming in for treatment, yet our own people in our own city cannot access the medical center for treatment. Why is that? Because they're either uninsured or they're underinsured. Even when those people are insured, the deductibles are so high that they cannot simply afford to go to the medical center. And the last part of this is bias in treatment. And this is something that health professionals, communities, advocates have been battling for many, many, many years. As I mentioned, clinical trials, the medications that are on the market today are not meant for minority communities. The people that they develop those medications for are white Caucasians. Because the reality is that in clinical trials, the majority of people are often white. And they are from a background where they're able to get into a clinical trial. Even when people in minority communities want to get into clinical trials, it is very, very difficult to get in if you don't know how to find a clinical trial, how to advocate with your doctor to get into a clinical trial. So these are things that we really, really need to work on. This bias in treatment is a big issue, and it's not something that can be solved overnight by one person or one organization. This is going to be a collective measure. And if you're wondering about Texas not expanding Medicaid and what our uninsured population is, we're at 16.7% in Texas, which is well above the national average. That's almost 1 in 4 people, or 1 in 5 people almost, that do not have insurance. And when they do not have insurance, that means they do not have access to healthcare. So what does that do? When you don't have access to healthcare, what does that actually mean? So here are some figures for you. I'm all about data because data is it tells a powerful story. So when it comes to Black maternal health, 44.8 per 100,000 women. That's what, sorry, let me go back. That's the rate of women that die per capita in this situation, which is much higher for Black women than it is for white women, 3 times higher. And this is a figure that should concern everybody because, again, we have the biggest medical center in Houston. We have all sorts of specialties. We have MD Anderson, we have Methodist. We have a lot of hospitals that can help to alleviate some of the burdens that you see on this screen. However, people don't have access, and that's why these figures look like this. 1 in 5 Black adults report that their healthcare provider treats them unfairly. And these aren't numbers from the past. We're looking at 2024 when this data was collected. And that tells you, again, that there needs to be bias training with our healthcare providers. That just assuming that every doctor is the same is a mistake that we're all making. So our clinicians, our pharmacists, our doctors, our healthcare providers, they all need to go through bias training and understanding the people that the people that they are dealing with, the people that they are treating. And the only way that can happen is, again, if minority communities speak up, making changes at the Texas legislature and also at the federal level. Right now, they're looking at getting rid of categories of Asians and putting them with the Latino population when it comes to when you fill out your form and you say what race you are on a health form, and it gives you the you can say you're Asian, you're Latino, you're Black. Well, they're going to get rid of some of those categories, which would mean that I, as an Asian woman, if I am considered the same as Latino, think about our health. What is the difference between a Latino woman and what's the difference between an Asian woman like me when it comes to health? Well, our genetics are different. Our genetics, so that's one thing. The other thing is that because of our genetics, the things that impact us health-wise, like our heart health, our kidney health, obesity and things, that's going to be totally different. How can we expect to receive the same health care and expect it to work for both of us? So those are things that we really, really need to pay attention to, especially when it comes to the politics of our country and what is happening with healthcare. So now this third category that we're looking at is the uninsured rate. So uninsured rate in Black adults under the age of 65 is at 10.1% when it is 6.8% for white adults. That's a huge disparity. So 1 in 10 Black people do not have access to healthcare. And again, there's a lot more when it comes to disparities and barriers that people face. Your zip code can determine the type of healthcare you receive. And this brings me to the point that I was talking about earlier, that we live next to the world's largest medical center, yet we have the nation's worst outcomes. So it's not that people are living in health deserts and they have other structural barriers. It's a fact that they're living next to a medical center with the best doctors, yet they are barred from access to that healthcare. And so, again, these are some numbers that show us what's happening in Harris County, 83.4 per 100,000. That's double the number that you saw earlier. It's 4 times higher than for white women in the same county. So this is concerning and should be concerning for all of us. When it comes to morbidity in Harris County, it's on the rise. Between 2019 and 2024, we outpaced what was happening statewide. So the crisis is worsening, it's not getting better. Black infant mortality, 11.66% per 1,000. That should be a concerning number. And this is what really gets to me. This last number, 1 million plus people in Harris County are uninsured. That's 1 in 4 residents. So those people do not have coverage from Medicaid, and they're not able to get marketplace plans either because they can't make the payments. And those are the people who need to go to the federally qualified health clinics, or they need to go to safety providers like Harris Health. But as I mentioned before, 340B is about to make changes to how those safety net providers receive medication, which means that if they can't provide medication to their population, it is only going to make these numbers worse. These numbers, if the 340B passes and they don't provide the reduced medications to these safety net providers, what you're going to see is Black maternal health will go up. So you'll have more women dying. Black infant mortality will go up. And this number, which is already bad, is going to go up exponentially. So this should be concerning to all of us. So how did we get here? This wasn't accidental. It wasn't coincidental. There's a history behind how we got to the point today. How is it that we are a superpower of the world? We have some of the best medical expertise in the country. We have huge medical centers. Houston is world renowned, yet people in the immediate area are dying. So this is because of policy. So those of you that are running for office, here's a little bit of a history lesson. 1946, the Hill-Burton Act. What that did was the federal hospital funding permitted separate but equal facilities. So that meant that it just entrenched segregated care. So even though it was separate but equal, those facilities by no means were equal. The hospitals that facilitated minority communities, especially the Black communities, had a lower level of care than their white counterpart hospitals. Then in the 1930s to the 70s, you had the Tuskegee study where Black men especially were used like guinea pigs in an experiment. And it was all unethical. They weren't asked for permission. This went on for decades. And that's why there is a huge mistrust in the Black community when somebody says clinical trial. And there's a lot of work that needs to happen around that, especially awareness on why it's necessary to be in a clinical trial. The first thing when I go into a community, and the first question I get asked is, it's great that you're bringing these services, but who's looking at my data and what are they going to do with my data? And those are very, very valid questions. So if you're somebody working in healthcare, then these are things that you need to consider. So now in the 30s, we also had redlining. So there was a disinvestment in Black neighborhoods. Black communities were segregated from services. They weren't allowed loans. They couldn't buy homes. So they lived in parts of the city that were pretty run down, did not have the economic development. And again, those places became hospital deserts. They became health deserts. And that's where you have your environmental health burdens. That's where your concrete crushing facilities are. That's where you're going to have your rock crushing facilities. That's where your petrochemical facilities are going to be. And that's because of a red lining. And now, right now, we have, as you guys were discussing earlier, the non-expansion of Medicaid. And so it's the same people who, from the 40s up until now, face the same barrier of not being able to access healthcare. It's not because they don't want to, it's because the system has been designed to keep them out. So it was policy that created this gap, and only policy can change this gap. So the question I was asked earlier is, how do I turn my passion, my outrage into organized, sustained pressure? That was a really good question. Well, the number one thing that you want to do is you want to advocate for policy shifts at the local level, right? In Harris County, you have a safety net provider. You have Harris Health. Do everything in your power to make sure Harris Health is protected. If there are things that you can do, go and speak to the commissioners. There may be action that you might be able to take. There were a couple of years ago, they had some items that were on the ballot. Educate people on things like that. Our safety net providers need to be protected, especially with this government. At the state level, Medicaid expansion, keep fighting for it. I know we haven't been successful, but at some point, who knows? It took many, many years for the Civil Rights Act to pass, for the Voting Rights Act to pass. This too will take time, but failure does not mean we can give up. We just don't have that privilege. We can't give up. We have to continue fighting. Demand accountability. If they don't respond, if your representatives are not responding, find ways. Somebody mentioned that write to the editorial board. Absolutely. Keep writing to your papers. Get the attention of journalists. Do op-eds. Reach out to advocacy organizations who are working on these issues and work with them. Find representatives in the community. Find representatives at the state level, senators at the state level that will help you push this in the legislature. So what is it that needs to be in the bill? What changes can you make? How can they work together? Connect your representatives with other representatives. Connect them, the senators, with the other senators. Because I know people like Mohammed Nasrullah, you have a huge network, not just in Houston and Harris County, but you have a network across Texas. Lean into other cities, lean into other counties, and see who you can find and build a coalition. At the federal level, there's a lot happening. Unfortunately, with this government, they are about to make all sorts of changes. As you saw months ago, there was changes to childhood immunization, and that's ACIP. They got rid of ACIP. Now they're trying to assemble ACIP, and we don't know what the schedule for childhood immunization is going to look like. So things like measles that at once upon a time, the US had no cases. It's coming back, and it's coming back with a vengeance. You're going to see more and more of that. You're going to see more of polio. You're going to see more of other childhood diseases that prevent children from thriving, growing, and reaching adulthood. So more children will be dying at a younger age from diseases that are preventable. So again, petition your federal representatives, your federal Congress people, and tell them to reinstate the previous immunization schedule for childhood vaccinations. Because as time goes and less parents are made aware of the vaccinations their children need, the more likely we're going to see those infant death rates rise. And then build your community power. And what does that look like? Connect with other organizations, connect with nonprofits, connect with the faith-based organizations, connect with health workers. If you're not already familiar with Harris Health, they do amazing work. Reach out to them. They have they have so many different departments, but you can reach out to your commissioners as well, and your commissioners can help you connect with them too. Because what you might find, you might have somebody in your community who is lacking access to healthcare. You might be able to talk to your commissioner, and your commissioner might be able to connect you to somebody at Harris Health that could connect that person to a provider or a specialist. Harris Health has oncology, it has kidney health, it has all sorts of specialists that people can have access to. But the problem is, a lot of people in the community are not aware. They're not aware of what Harris Health exactly does. They're aware that they might have some clinics, there's 2 hospitals, but what they provide, people are not aware of. And so it falls on all of us to inform the community of what is available in the community. We have federally qualified health clinics. Legacy Community Health is a good example. Hope Center is a good example. And then we have community-based clinics. Ibn Sina is an example. And there's several others in the community. make sure you are connected to all of them and understand what's happening with those clinics, where the gaps are, where the shortfalls are, and then connect with your lawmakers and say, hey, here's a gap that we noticed in safety net providers, in community clinics. We want you to work at the federal level or the state level to pass this bill, to provide funding, to do this. That's how you organize community, and that's how you organize power. But this is the best way to work. And it takes years to get change, but it does happen. And so my thing is, please do not give up. There's so much happening. Like every day, as somebody who works in healthcare, I read the news on healthcare every day. And right now, it is a scary time for us to be living in. It is a dangerous time for many of our communities, and many people as well, whether we're talking about children or people over 65. A lot of the things that are happening at the federal level are putting these people at risk. And unless we do something, we are going to see these numbers that you saw earlier rise. And that's what we want to prevent. And so here are 5 steps that you can kind of use to get something going with your representatives. So what is it that you're asking for? It's very easy, and often people do this, and I used to do this as well when I used to, when I started off. You write to your senator and you write to your representative, and your ask is very broad, right? And you're telling them to do something, and that's why a lot of the times unfortunately, it's not the lawmaker who's reading these letters, it's a member of staff who's reading these letters that you send in, and they're then sending you a template email. And I know this working in government myself, how these things work, right? So when you're making an ask, make a very specific ask. What is it that you're asking them to work on? Well, you could take the Black maternal health numbers and say, hey, we see that the numbers in Black maternal health are atrocious and that there are more deaths that we're seeing in the numbers. We would like you to provide some wraparound services for our area. So work with your Texas representative and say, okay, what can we do for our particular precinct? Can we find a clinic that we can work with? Can we provide them funding? What is it that we can do? What your representatives can also do is they need to be connected to all the nonprofits that work in healthcare. Because if they're not able to pass laws, then they need to still be able to connect you to a service. And if they're connected to all the nonprofits, then they will know that so-and-so nonprofit can help this person who is in trouble. If somebody's going through cancer and they need a clinical trial, who is it in my portfolio of nonprofits that can help me connect this person? And I've worked with a lot of elected officials who are very, very good at doing that. But it is your responsibility to make sure that your particular representative is connected to the nonprofits that can help. And then know who your lawmakers are. Who is it that is over your precinct? Who's over your House? Who's over your Senate? If you don't know, here's a website, capitol.texas.gov, and look them up. Build your petition. Again, it's very easy to go broad. I say go narrow and maybe work on something that might be achievable. Then work with people who are immediately local to you, and then take it to your representative. If you can get people in your zip code to sign up, then your representative is more likely to pay attention than you trying to get a signature from somebody in Corpus Christi saying that they want healthcare in this area. So be mindful of what you're trying to do. Gather the signatures. You can do Google Forms. There's lots of online platforms that you can access and build your petition. And then once you deliver, follow up and follow up and follow up and follow up until you see change. And that might mean on that same issue, you work on your Texas legislator, you work on your federal representative, and you write to them every couple of months and say, hey, I'm following up on this. What is happening? They should be able to give you a response. If you're getting a response that's a template, then call their office and ask for a meeting with the representative. Ask for a meeting with your congressperson. Ask for a meeting with the senator. Sit down with them and walk them through of what the issue is and what you're trying to acquire. But this is the easiest way to get something going and impact policy and make change. And so, again, this brings us back to how do we get to this point? How do we get to healthcare is a right, a human right, and it should be a right for everyone. It's all about working with the right people to build coalitions, build power, and then make changes at every level of government. You start locally with your council members, your county commissioners, then you go to your state legislator, and then you go to the federal level. But you've got to engage all of them because it will take all levels of government to make changes in the lives of the people that we want to impact. Those numbers that you saw will only change if all levels of government work together. You can't have the federal government passing something and then finding that your state and your local government isn't working on it. That doesn't work. Or you find that your state government wants to do something, but your federal government and your local municipal government is out of sync. So you have got to build your coalition in a way that you address all levels of government and you follow through with each. If you're a coalition, you can dedicate people to just working on the municipal level. You dedicate people to working at the state level, and then you dedicate people to work on the federal level, and that's how you achieve change. So thank you very much. That was my presentation. I think I kept to the time, or maybe I went over, probably went over. I'm sorry about that. But I would love to hear what you have to say about that, and I would appreciate any questions that you have. I'm going to stop sharing my screen.
Yeah, so Munira, thank you so much for this wonderful, wonderful presentation. So, all of you who have questions, raise your hand and our Zoom master will give you your turn. Raise your hand physically or the Zoom hand, and we'll just take turns and answer. Munira will answer your questions. Okay, Afshan, go ahead.
Yes, thank you, Munira, and thank you, Mohammed, for this amazing event. Really was glued to the my phone. I'm at my mom's nursing home, just taking care of her, and it really brought home so many questions and so many things that need to be done. So I'm trying to. There's two different things that I am a little bit. I want some clarity on, really. One is the process for renewing Medicaid is really complicated. Is there some? I mean, it's like a 21-page questionnaire, and some people are. I mean, I'm unfortunate to be computer literate and whatnot to be able to have fun with it, but a lot of these people cannot do it. Even in the nursing home, they don't know how to do it. And also, there's a catch-22. Mom has been a citizen and has had Medicare ever since she was eligible, but Medicare required her to send in a bank statement. Well, she hasn't had a bank account in several years. So when you don't have a bank account, they don't consider you to be a participant in Medicare because they send out a $30 check every month and they have no place to deposit it. But so Medicare dropped her. It's just unbelievable on how it's been 4 years, and I have tried back and forth to tell them I cannot open a new bank account for her because then it will initiate a whole new set of questions on why she hadn't had one before, what happened to the ones that she did, when was it closed, and I don't have all that documentation. So I've opened up a trust fund with her at the nursing home, and that's also been a year. And there's no money in there, but mom doesn't have Medicare. So now she cannot see her specialists, heart, kidney. She has a massive kidney stone that needs attention, but due to the paperwork or the red tape with the paperwork, she's shut out from that portion of the healthcare that she should be eligible for. So that is, finding people who could listen to you and help you through and these challenges. I can't imagine how it is for people who don't have a computer or have language issues or so on. Even with the facilities that we have, we're having a hard time. And the second question, Munira, is what do you think about Medicare for all? Is that something that we should be pushing for, or would it be detrimental to people who are already on Medicaid? Thanks.
So your first question, unfortunately, I wish I could say yours was a unique situation. This is a very common situation in minority communities where they cannot access, Medicare or Medicaid because of the barriers that are in place. Like you mentioned, the bank account. It's very hard to, complete the process if you're missing some things. And I know that there are organizations, and I may have to send you an email on where you can get help, but there are organizations that will work with you to help you through the process. I know that Commissioner Briones in Harris County, she has somebody there that they work on things like that all the time. It may mean that you may have to reach out to elected officials in your area to find those organizations that can help you get past this process. And it may mean that sometimes your elected officials even have to advocate for you. Now, whether they'll allow you to bypass a bank account or not, I can't answer that. But they should be able to help you navigate the system. Because you're right, it's not easy. The process is lengthy, it's confusing. So finding somebody, and the best thing to do is to reach out to your elected officials and see how they might be able to connect you to somebody who can do that. And then your second question was, remind me what your second question was again. Rafshani, you there?
Oh, I didn't unmute myself. Yes, Medicare for all. Is that something we should be pushing for?
So I'm going to give you some. I was born and raised in the United Kingdom, and so where we have the National Health Service, which is a form of, I would say, Medicare for all. It's a free service. You go to the doctors. You get all your services for free. Is it a perfect service? Absolutely not. And I can tell you some horror stories from my own experience of what happened to me. But I do know that it's flawed, but there are positive sides to it. If you're going to have Medicare for all, then you need to make sure it's funded. Funding is the biggest thing. There is no point in putting a system together where people are waiting 2 years before they can see an oncologist. They're more likely going to be dead by then. So Medicare for all, if you support it, then make sure there's a mechanism for funding. And there are plenty of our representatives who talk about Medicare for all and actually have a plan to fund it. And so if you're running for Congress and you're supporting Medicare for all, please, please, please have a plan on how you would fund Medicare for all. Because I come from a country where the NHS, unfortunately, recently has been failing a lot, and there's a lot of issues. But even though I come from a system that gave me a lot of issues, I still believe that everybody should have access to healthcare. It is about changing the system and perfecting it. And if that means that you find ways to fund it, be creative, like Mamdani has been doing in New York, then that's what you have to do. But it shouldn't be that we exclude communities from accessing healthcare because we're all worried that we're not going to be able to see a doctor if everybody has access to healthcare, or the quality of healthcare isn't going to be good enough for us.
Okay, who's next?
Thank
Oh,
you.
Niloy.
Hi, Munira. First of all, thank you for being here and explaining these really complex topics. Like, it's made it really understandable for me and given me like concrete courses of action. I actually can't wait upstairs to just talk to my wife and be like, this is all I learned today and just like geek out with her. But a question I had, so there were some problems you talked about, the systemic inequality of people of color, their access and their treatment in the healthcare system, and then kind of some programs and solutions. So bias training is like sounds like a very promising kind of initiative, and I'm sure there's a lot more. But the kind of inquiry or like the problem or the kind of thing I want to point out is like how do you ensure when the users, the actual people, the black women, black men who are who are signing up and receiving the healthcare, we receive the feedback afterwards because you yourself talk about how after Tuskegee there's a systematic distrust and a lot of bias against using it. So how do we, make sure that we're able to address it and understand like whether there is improvement or not, and just basically hear out the communities, like what is the mechanism for that?
So that's why my center works a lot with the faith-based communities, because you'll find that whether it's your priest, pastor, your imam, or whoever your religious leader is in your community, you are more likely to trust them than somebody who you've never seen before come into your community and tell you to take a test or try and raise awareness against a disease. Their intentions may be good, but you don't know that. So you're more likely to listen to somebody who you trust. And most people they're spiritual, right? And so they will attend some house of worship where they'll talk to somebody. And that's the best way to get the message across. And that's why, and then people who aren't going to houses of worship, not everybody believes in God. So people go to get their hair done though, right? Or they get their nails done, or they'll find something. So find those people who want to help in the community and use them. Those are your ambassadors. Those are the people that can help you connect to the community. And that's what we go into a lot of cities. I'm doing a huge project right now in Flint. They had the water crisis, the lead in the water, and we're doing early detection there. Now we're a national organization going into a city who has had years of issues with their government and doesn't trust anyone. It really isn't easy working in those communities. So what do we do? We go in, we find those trusted voices, and we make them the people who provide the information, who give the education, and we're there to just support them. That is the best mechanism to use. And that's why my thing to you guys, you have a huge reach in your communities. You're all very politically engaged. You're all very aware of the issues. Use your voice in your own communities as well. It's excellent that you want to reach out to your representatives, which you absolutely should, but reach into your community as well, because that's how you're going to know what the issues are. That's how you're going to know where the gaps are, and that's how you're going to know what policies you need to shape in your immediate area. Before fixing the world, you need to fix your street. So that's where you need to start.
Thank you so much.
Okay, is anybody else have any questions? We got 4 more minutes. Okay. I got a quick question, Munira. I mean, recently when we had the issue with the social studies curriculum, there were a couple local organizations that helped with the advocacy part of that work on what to do, how to do it, where to do it, and all that. In the public health area, are there any advocacy similar organizations that will help the local community uh, guide them with the advocacy work?
So actually, my center is actually working on advocacy training for some church leaders, and this is taking place in Washington, D.C. But I could absolutely find funding to do it here in Houston, and you know, but that is we cover health issues and how you basically work with your representatives in your municipal and your different levels of government to bring those issues forward. In fact, a lot of I don't know if you're aware, but the government is trying to change the law right now for nonprofits that get a federal grant. And so if you say you're an organization that works on diversity or you work on equity, then that means the government can pull your funding at any time. And we're not talking about educated people doing this. Somebody in a department, some aide doesn't like what you're doing, they could go ahead and pull your funding, which is traditionally has never been allowed. The government cannot pull your federal funding without actual reason, and they have to give you the opportunity to contest it. With the changes that they're trying to make, you won't be able to do that. So if you are, one of the things that happened in the last few days, the Black churches are really worried because they're trying to advance healthcare and equity in their communities, and some of them have nonprofits that have been applying for federal grants, and now they find out that this rule that could potentially change how they operate is going to be detrimental to their community. It's really, really worrying, and I think that's something else that everybody needs to kind of look into. The comment period for that is July 13th, I believe. But this is going to impact a lot of houses of worship, nonprofit organizations, because you can't work on anything that might give the impression that you are running a diversity program. And so they're making diversity a dirty word when what really it isn't. And so if you're able to comment on that, that would be absolutely amazing. But it's a complex matter that, like you said, somebody needs to break it down and explain it and go through it so that communities know what to do.
Thank you. If there's no more questions, Munira, thank you so much. This was really a fantastic presentation, and I've been getting messages. So many people want to connect with you, so I'll talk to
Absolutely.
you. Yeah, and yeah, and I'll talk to you and see if I can share your email address
Yeah.
or telephone number or something.
Absolutely. Please do. Please do. I want to make sure that I connect with people who have questions or who need follow through or just awareness, or there's a gap in your community, or you want to understand what early detection is, cancer early detection, things like that. I want to expand the programs in Houston and Harris County. I'm trying to talk to our companies that fund us to bring more programming here. I wish I had time to go through the cancer data in Harris County because that is extremely shocking and worrying. But sometime in the future, maybe I'll have the opportunity to share that with you. But those are things that you need to be, actively aware about. These are things that are happening, in our streets, in our neighborhoods. Most of us live in Harris County, and so here's a real issue. Brain cancer is prevalent in almost all of Harris County. And so, yeah, I would love the opportunity in the future to go through that and the implications for that and how you can advocate for early detection in your community and get the government to work with your insurance company so that those tests are free for you. And you're not having to fork out $3,000 out of your own pocket to find out if you're going to develop cancer.
Yeah, we'd love to have you come back, maybe later on this year or early next year.
Thank you.
you.
Thank you so much.
Our next meeting in August will be on August 3rd. And for all the new folks that I notice are attended, if you want to receive our notifications, we normally send maybe 2 emails a month. So if you want to just send me a text or a WhatsApp message, I will add you to the to their mailing list. And Roger, your hand I just noticed your hand is up. Do you want to unmute and ask your question? Your
Yeah. When you heard me earlier, we were just walking in the house. We had just made it back from New Orleans, just drove back in. What I want to bring up, on the 21st of this month, we're going to have Rhonda Hart, who's running for Congressional District 36, is going to be our speaker at the Bay Area New Democrats. I just wanted to share that.
Oh, okay. So 21st.
Yeah.
Do you have a location because the community center is shut
It's
down?
scheduled. It's supposed to be at the community center next week. The community center is supposed to be opening back up next week.
No.
On the 13th.
Okay.
Well, that's
All
what
right.
I was told. Well, right now we'll put out notice, but right now the 21st
Okay. All
is
right.
actually the meeting. Okay.
All right. Thank you, guys. Thank
Mhm.
you.
Thank you.
Bye-bye.
Bye.
Bye-bye.